So the first one, where do you see or what shows the Reynolds broad phenomenon?
Candida.
Candida albicans.
Candida albicans. And which other Candida?
Glabrata.
Candida albicans and Candida. Remember Dublin wala. Okay, albicans and Dublin. Right, correct, Dr. MD. Right, Dublinensis, that is what gives Reynolds broad phenomenon, which is also called as
Germ tube form.
Germ tube.
right. However, we remember that germ tube which looks like a candy, so that is Candida. Okay, that germ tube is like candy, the lollipop, it is candy. Candida shows that. Okay, next one, hereditary angioneurotic edema is due to deficiency of
C1 is
Esterase.
C1 esterase. Yes, and that's basically C1 inhibitor, right? So because of that, if the C1 inhibitor is not there, then the complement gets overactive, and then you get that hereditary angioedema edema. Next one, HRP2 positive is what plasmodium?
Plasmodium.
Falciparum.
Only falciparum?
Yes.
Yes. So
Yes.
remember that HRP2 positive, if they give you, it's only Plasmodium falciparum, that is histidine-rich protein. While all the Plasmodium species, what is that positive?
LDH and aldolase.
Correct. LDH is what you should definitely remember. So remember, LDH positive is all ALL, L for LDH. That's how you remember. And HRP2 is only falciparum. Next one, with what parasite do you see the larva in stool? Not the eggs, but the larva.
Strongyloid.
Strongyloides cercoralis.
Strongyloides cercoralis. Why? Because it has auto-infection. So the eggs, they are hatching in the intestine itself, and the larva, rhabdiform larva, is what comes in the stool, right? And remember the process of parthenogenesis, and in the life cycle, you might also see like man to रहेगा और क्या देख सकता है in the life cycle में?
Dog.
Correct. Strong is dog, right? So man and dog. Next one, what is the drug of choice for invasive aspergillosis?
Voriconazole.
Correct. Aspergillus A का उल्टा करेंगे V, that's voriconazole, and aspergillosis shows what kind of hyphae?
Septate.
Acute angle.
Septate.
I like
with what branching?
Acute angle branch.
Angle. Correct. Remember, Aspergillus A, when we write A ka angle is acute angle, and the line shows the septate. So septate with acute angle branching, that is aspergillosis. Next one, what is which is the acid fast filamentous bacteria?
Nocardia.
Nocardia.
Correct. Nocardia is acid fast, and actinomyces is not acid fast. Which one is an anaerobe out of that?
Actinomyces.
Actinomyces.
Correct. Actino is NO, that is anaerobic. And nocardia infection. Generally, how do we get nocardia infection?
By soil.
Soil. Saprophyte.
Soil जाता है, lung में जाता है, और brain में भी जा सकता है. That is important. And what is the mnemonic for drug of choice for these?
Snap.
Snap.
Sulfonamide, that is cotrimoxazole for nocardia. Actinomyces के लिए
Penicillin.
right?
Penicillin.
SNAP, penicillin for actinomyces. Correct. Next one that you have, if there is antigen excess, it leads to what phenomenon? The prozone or the post zone?
Post zone.
Ozone.
Post zone.
Post zone.
So, correct. Remember, antibody excess and antigen excess. Antibody, B comes first, so it is prozone, and G, antigen. G comes बाद में later, so that is post zone. So they give you like in the question ki pehle the test is negative, and then after serial dilution the test comes positive. So that is suggestive of prozone phenomenon, the antibody excess. Next one, what is that egg which is barrel shaped with bipolar mucus plugs?
Enterophas
Trichuris.
Correct. Trichuris trichura is barrel shaped bipolar mucus plugs, and you should remember the association of trichuris with
Rectal prolapse.
rectum.
Remember rectal prolapse, very, very important. And in which parasite you get vitamin B12 deficiency? Diphyllobothrium. And where do you get iron deficiency?
Ankylostoma.
Ankylostoma. That's hookworm, right? Next one, Pseudomonas aeruginosa. Is it aerobe or anaerobe?
Arrow.
Anaerobe.
Aerobe.
Sorry, aerobe.
Aeruginosa.
Remember,
Aerobe.
aeruginosa is air, aerobe. Is it oxidase positive, oxidase negative?
Positive.
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 Very,
Positive.
very important. Remember, it's oxidase positive, gram negative, and lactose fermenting है कि non-lactose fermenting?
Non-lactose.
Non-ferment.
Non-lactose fermenting, oxidase positive, gram negative. It's going to be Pseudomonas. And does it have a toxin?
Yes.
Yes, right? We have seen the toxin acts by what mechanism?
EF2.
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 EF2. 2 is di and do. Diphtheria.
Diphtheria and Pseudomonas.
Correct. And which are the lactose fermenting?
E. coli
and Klebsiella.
Klebsiella.
Correct. Remember, write
LEK.
lactose as LEK, right? Rather than writing LAC. LEK, the EK tells you it is E. coli and Klebsiella, which is lactose fermenting. Next one. Which Neisseria ferments maltose? Gonococcus, meningococcus, or both or none?
Meningococcus.
Meningococcus.
Remember M for M. Meningococcus ferments maltose. Glucose दोनों करते हैं. Gonococcus also and meningococcus, but meningococcus ferments only meningococcus only ferments maltose. M for M. What is the mechanism of action of cholera toxin?
Zot called
Zot.
This is
GM1. Inhibition.
CMP.
GM1 gangliosides.
CMP.
The receptor is GM1, ganglioside. And what is the mechanism of action of toxin?
Increasing CMP.
Increasing camp.
Increases
Cam.
AMP by acting on GS or GI.
GS.
GS.
Remember, it acts on GS. It activates the GS, not inhibits the GI, and then it increases cyclic event. Okay. So that is cholera. कल हमने देखा था mini GT5 discussion में cholera का vaccine. What was that?
And
Fungal.
and
Chantol, which is also now replaced by Uvicol. What was the advantage with that? Why do we use it in mass campaigns?
Well, you can give
No buffered solution.
Correct. No buffer is required. It is
Bivalent.
bi-dose. 2 doses are required, right? So remember that is Chantol or Uvicol. It does not require buffer and it is used in mass campaigns. Next one, McFadyen's reaction is positive with
Bacillus
Bacillus anthrax.
anthrax. Correct. Remember, McFadyen ending in an. AN is anthrax. Anthrax is important. Your what disease? Anthrax
pulmonary anthrax.
and
Cutaneous
anthrax, right? Bull sorters and Hyde Potters. So bull going into the lung and Hyde Potters on the skin. Pulmonary and cutaneous anthrax. Remember, cutaneous anthrax, classically the lesion will be shown as
black color
Black
colored.
Type patient.
Correct.
medium.
It is malignant pustule. Okay. Malignant pustule, also called cutaneous anthrax, is also called as malignant pustule. Okay. और anthrax का भी toxin कैसे act करता है?
AMP.
CAMP, cyclic AMP increasing, right? So it has an edema factor as well, causing increasing cyclic AMP. Next one, outside inclusions. Easy. PMB. Remember, I, we see with the I. So I is C, that is CMB. And remember the mnemonic in CMB, C with the I outside. M is, you turn it, becomes a E. SNH. And V is
Periventricular
calcification.
very good. That is periventricular calcification. It's a very important cause of non-syndromic SNHL in children. That is CMV. Okay, very, very important. Next one, if there's transplant happening from father to child, what kind of graft will you call it? Autograft, isograft, allograft, xelograft.
Autograft.
Self. So autograft तो नहीं होगा.
Allograft.
Allograft.
What is isograft?
Identical twins.
Identical twins.
Correct. Isograft, I for I, remember iso, similar, identical twin. Allograft is same species, like father to child. And xenograft is X, entirely different species.
Different species.
Yes, that is xenograft. Okay. Next one, motility. What shows darting motility?
Cholera.
Shooting
Cholera.
and
Cholera and
Campylobacter.
Campylobacter. Remember CP, CC, cholera, Campylobacter, D, darting motility, and tumbling motility is?
Listeria.
When everything is tumbling down, you make a
To-do
list.
list.
To list, right?
Pulcum.
Medium for Listeria, Pulcum medium.
Pulcum media.
Yes. Next one, if you see Maltese cross and RBC, what are you thinking?
Babesiosis.
Babesia microtia.
Correct. Babesiosis, right? So RBCs में होता है, blood transfusion से हो सकता है. And what is the vector for babesiosis?
Hard tick.
Hard tick.
Tick.
Who है hard tick tick tick.
Tick,
So
tick.
that was our rhyme the song. So baby is babesiosis is hard tick. Exorded tick, hard tick. Right? And Maltese cross in urine.
Fabric.
Fabris.
Febris affecting the kidney, right? Renal failure. So that is where you would have Maltese cross in urine. Next one, tuberculate macroconidia.
Histoplasma.
Histoplasmosis.
Correct. Histoplasma is very similar to TB, right? So tuberculate microconidia. Histoplasma HI hides in the macrophages. That is what you see. And also remember important manifestation, because it's similar to TB. It can infect the lung, have calcified lymph nodes, plus the skin or the oral lesions, palatal lesions are common with histoplasma. Okay, that's also a manifestation there. Next one that you have is painless indurated genital ulcer.
Syphilis.
Correct. Remember, syphilis is painless. Right? Painless ulcer, painless lymph nodes, that is syphilis. So what test will you do for that?
VDR.
BDRL.
And what else before that?
Serology.
Remember,
Yes.
dark
Dark field
Dark field
microscopy.
microscopy.
dark field microscopy for spirochetes. So for syphilis, you would do that. For neurosyphilis, you have VDRL. That is what you are going to do. VDRL is what you monitor for response to treatment as well. Okay. Next one, OXK positive.
Scab typhus.
Correct. Remember OXK, K is scrub. When you write scrub, write it as SKRUB. So it is scrub has, which is OXK positive. It's classically scrub typhus caused by rickettsia.
Tsutsugamushi.
Correct. Susugamushi. And what is the vector there?
Trombiculate
Trombiculate.
Correct. So remember Susugamushi, T for trombiculate, S for scrub typhus, and you have Susugamushi coming there. So scrub typhus, and what is the drug of choice for that?
Doxycycline.
Correct. Doxycycline is the drug of choice.
And ma'am, in pregnant female?
Pregnancy may you cannot give doxy, right? So what will you give in pregnancy?
Azithro.
Azithromycin, right? Macrolides you can give. Next one, what test do you do for leptospirosis?
Wheel.
And MAT. Wheel Felix is for rickettsia, right? And you have MAT, microscopic agglutination test for leptospirosis, classically where they would give you Rains wala history, Rats wala history, and Wheels disease, right? Icterohemorrhagic fever. So jaundice is there, kidney is affected. Red eye is given. It is leptospirosis, microscopic.
Conjunctival confusion.
Correct. Right. So those were the 20 quick questions revision that we have done within few minutes. You guys were great. Amazing.